What's up? What's up, Torian? I'm going live. We got Brendan who's coming on. I am trying to get him in the room. What's up, Brendan? How are you?
How we doing, Dave?
Good. Can you hear me? Are we all good?
I can hear you. Can you hear me?
I am. I can.
Dave,
Yeah.
are you
So,
still out on the West Coast?
I was just in DC like last week, and then I came back out here because first of all, it was hot and very humid, and I was
Yeah.
just kind of like, so now I'm back west for a couple weeks, and then I'll be back in DC in August.
Wow. Okay. Well, enjoy your time out in the West. I'm very jealous that you get to do so much traveling.
Uh, I know it sounds so bad, but everybody. Oh, look, I'm getting myself in trouble with some
Oh,
people. Uh,
I exposed you. I'm sorry. I didn't mean to.
so yes, I snuck in town like very quietly. But I'm David. I am influencer with Whitman-Walker Health. I've been with them for over a year now, and we come on here to talk about various topics about HIV, STI, health, and all that type of stuff. But I'm here today with Brandon, who's also part of our team. And Brandon, you can introduce yourself.
Yeah, I'm the community partner outreach specialist at Whitman-Walker, and I do a lot of work with the Instagram Lives too. So, super excited to be on today. We've been doing a lot of community health outreach on our social media platform during the pandemic. We cover various topics from like HIV, sexual health practices. We cover access to care, social determinants of health, general public health interventions. We're going to be focusing on that for the next series, for the next few Instagram lives. So please sure
For sure.
to learn more about COVID, ways to manage your sexual, personal, mental health, vaccine access, all that good stuff. We're here to educate and support you.
Absolutely. And so today, though, we are here to talk about a particular topic, and that is body image. Like, we all deal with our perceptions of our body and other people's perceptions of our body, which also may impact our perception of our body. But we want to talk a little bit about that. And I brought Brandon on here to help with that discussion because, of course, we're all concerned about body image. So, what is body image exactly, Brandon? What's your definition of body image? Just a quick
Um,
one, then I'll jump into mine.
my body image, I mean, like, not to define it with what it is, but it's like the image of your body. I think a lot of it is personal, like how you see your own body, because like there's the way
Right.
it looks, but like a lot of times when you see yourself, you don't see necessarily what everyone else sees. Like sometimes I'll be wearing something and I'll be like, I look this way, and everyone else will be like, no, you don't, or like, like very personal.
Yeah, so body image is the perception that a person has of their physical self. Body image perception stems from you, like Brendan said, your thoughts and feelings that surround that particular perception. But these thoughts and feelings actually influence, your environmental, can be influenced by your environmental factors, which can cause these feelings to be, maybe have a positive or a negative or both impact on yourself. So in our culture, we tend to have, this ideal body figure or this ideal body type that has become an obsession that, honestly, most of us cannot achieve. It's honestly unrealistic oftentimes.
Yeah, and I think it's important in this conversation when we're talking about like how this directly impacts the MSM community or the community of men who have sex with men.
Hmm.
Attempting to achieve this unrealistic body image is a driving factor for body dissatisfaction among men and women everywhere. But there are reports that there's a very high percentage of body dissatisfaction in the LGBTQ community specifically. So it's reported that gay and bisexual men experience elevated levels of dissatisfaction compared to heterosexual men. Just to give you some numbers, 32% of gay and bisexual men report negative body image. So that's a third of gay and bisexual men.
Right. And so, like, obviously, that is an elevated level of body dissatisfaction, but it may be a result of a greater emphasis on physical appearance in the gay community. I am a part of that community, and I know how tough it can be. So, studies have shown that this can cause higher levels of eating disorder symptoms, increased likelihood of experiencing depressive symptoms, and increased sexual anxiety and poor sexual self-efficacy. So, I'll let Brandon give a little information about that.
Yeah, body satisfaction has been shown to be tied to overall like sexual health constructs that center the body. So folks who are dissatisfied with their overall appearance may find sex really challenging and anxiety provoking, since attention is focused on their body and their body
Right.
parts. So in a study that was published in the literature done on gay men, lesbians, and heterosexual men and women, 42% of gay men stated their body image negatively impacted the quality of their sex life. So that's almost half of gay men reporting that how they think about their body is making sex worse for them.
Right. And someone actually said my body is hot. Thank you. But believe whether you think that or not, I still struggle whether or not I think my body is hot. And so I've also been a victim of this, believe it or not, that when it comes to like self-efficacy, like, and that can be described as a person's ability to assert their needs or their desires in these sexual situations. So, as an example, one topic that often comes up in conversation surrounding sexual efficacy is condom usage, right? So, in this same study, gay and bisexual men who were dissatisfied with their body image had poorer sexual self-efficacy, which basically means it predicted condomless sex with discordant male partners, which basically means that if a person is insecure about themselves, they're less likely to use condoms during that particular sexual in that event.
That's super interesting how like the way that you think about your own body can then affect like your decision making, which then impacts your
Yep.
sexual. Yeah.
Right.
So we've put together like a little help guide. If you or someone um, has body dissatisfaction, body dysmorphia, and would like help guides, please visit or participate in one of the resources that we're about to talk about.
Mm-hmm. And so, a lot of people don't really know when they need to seek help. And the thing is, there are some signs that you can check for, and I've noticed this in myself, but also in other people that might just be oblivious to these signs. So how do you know that you should seek help? And some of the signs and symptoms of body dissatisfaction or body dysmorphia can include repeatedly checking yourself in the mirror or staying away from mirrors altogether. You might even want to isolate yourself from others because you don't want to see, or you don't want them to see, that offending body part, that body part that you're ashamed of. Oftentimes, folks who might experience body dysmorphia also spend a lot of energy camouflaging or covering up their perceived flaws. So if you're doing that, that might be a sign that you're struggling with this. Or going to like large lens or extra lens or of having your picture taken. If you're that person that's constantly like, oh, I need this retake it, you might want to take a step back and reevaluate why that is your thought process. Undergoing plastic surgery. As Brendan outed me, I'm in LA right now. As you can know, there's a lot of plastic surgery that happens in this environment, especially in our gay community. And sometimes, that happens where people, go under the knife more often or more frequently. And so if that is something that you're doing, that might be a sign that you're struggling with body dysmorphia. Picking your skin compulsively, obsessing over flawed body parts, like I already said, seeking reassurance repeatedly. Now, I do this myself. I'm always looking for that outside validation, but that's just a little self-work I got to work on myself. Comparing yourself negatively to others, we all do that. Feeling depressed or anxious or having suicidal thoughts, putting a lot of effort into changing that feature that you're ashamed of whether it's excessive exercise. And that can be a thing. A lot of people don't think about exercising too much, but it can. You can become dehydrated, you can overexert yourself. So excessive exercise, weightlifting, tanning, all these things can be harmful. Or spending a significant amount of time on personal grooming. Yeah, those are some signs. So pay attention to those.
I think you and I have been laughing because we see like some of ourselves in these
Yeah.
things. And I know someone in the comment just put like, I have a bunch of friends who do these. I think
Mhm.
it's really common just to, like have these coping mechanisms. And a lot of them kind of are normal. And so it's important to be able to recognize from the list of behaviors that we're talking about, like, you have to kind of evaluate for yourself, is this just kind of like I'm generally looking at myself in the mirror, or is there something deeper here? Should I seek help? And there is support
Okay.
available for that. So
Yeah.
first, you give yourself credit for taking the step of recognizing that you need to seek help. It's a huge step. It should not be taken lightly. And there are a variety of resources available, ranging from more informal practices to more professional support. So it's really awesome if you just kind of like think about that, where you are, check in with yourself to evaluate like kind of what you need to do, how you can help yourself.
Yeah, and so if you are struggling, I do have some resources that you can refer to for support. First off, I always say, take a step back, take a look in. You can always use self-help. And something that I do often is practice mindfulness. Try engaging your senses and pay close attention to, the things in front of you, the task in front of you, and not allowing your mind to wander. Ask yourself questions associated with that particular event or that task at hand, like, what noise it makes, or what does it smell like? What are you really feeling in that moment? That is what it means to be mindful and go through that mindfulness experience.
Kind of going along with mindfulness, I also like to use meditation. So find like a comfortable sitting position, and really just check in with your body. Ask yourself, what am I thinking? What am I feeling? Spend some time, acting on those feelings without trying to push away the thoughts. I always close my eyes, try to focus my breath, pay attention to the way that it moves in and out of my body, trying to clear my head, spending a minute or two doing that, and then focusing on expanding the awareness to the rest of my body. So kind of that whole exercise is to center yourself, to take the focus off repetitive thoughts, which might be about your body, and your appearance. So that,
Exactly.
yeah.
Exactly. Yeah, that's a great recommendation. You can also, reduce negative predictions. And it's all about a mind state type of thing. So once you become more skilled at like managing your thoughts, you can use these coping strategies to talk to yourself or talk yourself down before you face a triggering situation. The next time you catch yourself thinking the worst, which we all do it, or you start expecting an event to go negatively, like try writing down your worst fears. I actually started doing this. Like if I'm interviewing for a new job or if I'm meeting a new person that I like, acknowledge those fears that you might have going into that situation. Try coming up with a more realistic outcome, because people aren't critiquing you and judging you as much as you think. And so, for example, I want you to, instead of thinking like, if you're going to a party, instead of thinking like nobody's going to talk to you at the event, try maybe, saying things to yourself like, I will meet someone new and we will have an interesting conversation. That is totally a different mind state, a different perspective to view things from. Just keep your thoughts more realistic, and it'll encourage you to be more positive and have more reachable expectations. We got
So
a
these
question.
strategies,
So I just want to see this question, Brandon. So,
yeah.
for someone who needs counseling because of this issue, but will likely say no, what strategy do you recommend for me to consider using them for to super consider going? Okay, got it. So, my advice, and Brandon, I'll let you give your take on that question as well. Um, it's very interesting because an approach my best friend is a social worker, so I feel like he does this to me all the time. If I notice that I am, critiquing myself or being overly harsh about my physical appearance, or just about, my insecurities outside of my physical appearance, you as a friend can reinforce positive thoughts, right? You can tell them what they're good at. tell them the value that they bring to the world. Those type of things help redirect those negative thoughts and help encourage. Now, if you are really looking for a resource, and you want to, like, you know, shift them or guide them towards a particular resource, one benefit I've seen people do is actually try that resource out themselves. Even though they may not need it themselves, go through the experience and then let your friend know what to expect, because that makes people more comfortable. Let them know what you gain from it and what they should anticipate they could gain from it. I would try that method.
Yeah,
What about you, Brandon?
that could be slightly harder to do for something like cognitive behavioral therapy, but like
Yeah.
maybe what I sometimes recommend is trying to destigmatize a topic. So just trying to find a really comfortable way to bring it up and normalize just talking about that sort of stuff. So talking about, seeking resources is something that's normal and healthy to do, and kind of leading that way into the conversation can make it a lot less scary than making it seem like you're having an intervention with them. I mean, hopefully it sounds like you know this person pretty well, and part of being a good friend is supporting them and connecting with the resources that they need. So I think it might be uncomfortable, but if you can break through and kind of normalize that conversation, your friend knows that you're looking out for them.
Right, exactly.
And speaking of professional resources, I was just going to start talking about how what we've discussed so far with like meditation, mindfulness, it's a lot of, as someone in the comment said, positive self-talk and reframing that you kind of can do in your own life without more support. If you do think you need to seek professional support, or you know someone who might benefit from it, there are psychological support systems as well as medical support systems that can help you improve body dissatisfaction or body dysmorphic disorder. First thing I'll talk about is cognitive behavioral therapy. So it's a psychological treatment available. It's the primary psychological treatment used for body dysmorphia. It focuses on changing the thought and pattern behaviors that are set off by the condition. So you have a therapist in this, and the therapist helps you identify situations that cause anxiety, and then they help you develop healthier coping mechanisms with that. So through CBT, you can learn to kind of step outside of yourself and think about your body in a more objective and then often more forgiving lens. This treatment process will also help you kind of rewire the way that your brain responds to triggers and helps you decrease compulsive responses.
Yep. And I feel like we left this for last because there are multiple ways that you could manage this, right? But there is medication. So in the U.S., the FDA has not yet approved medications for body dysmorphia. However, there are some things that you could do. For example, serotonin reuptake inhibitors could be very effective for this. These are a form of antidepressants that can help ease obsessive thoughts and behaviors and can reduce the symptoms of anxiety and depression and help put your mind at ease. So if that is something that you feel like you might need, it's definitely a conversation you would have with your medical provider. So are there any more questions?
Throw them in the comments. Dave and I are here to answer.
And we appreciate all y'all tuning in, by the way. And one thing I did not say, because I couldn't get it posted in time, is that Whitman-Walker is open for free HIV and STI testing by appointment only. You can call 202-797-4439. We are still doing COVID testing as also, so you can call 202-745-7000, or you can email us at appointments@whitman-walker.org. For those COVID appointments, COVID vaccination appointments. So if are there questions?
H-Town said one more. I bet H-Town is typing it out right now.
All right, so we'll let you type that out. But I do want to say one last thing as we wait for this question. And it is still about COVID-19. Y'all know I'm going to keep talking about it. It is what it is. We are still in the pandemic. We are still going through this. So if you want to get vaccinated, there are a dozen or so walk-up sites in Washington, D.C., where you do not need an appointment. You can just go there. You can get your vaccine. If you want to get vaccinated at Whitman-Walker Health, you can call us at 202-207-2480, or you can email us at appointments@whitmanwalker.org, as I stated earlier, to schedule your appointment. We'll also be out and about, as you know, at different events and our outreach events. So if you see us there, we can also register you there. So if you have got vaccinated, congratulations. The CDC has relaxed some of those mask wearing, requirements, and we can return to some of our pre-pandemic activities. However, I will say a lot has been changing, especially hearing about the Delta variant and all this stuff. So I will always say, stay on top of the CDC site. Make sure that you're reviewing that. And also, if you want to keep wearing your mask, the vaccine isn't 100% effective. So, and there are these more contagious variants that are spreading. So continue to follow protocols if that makes you feel more safe and more comfortable.
And the CDC actually is kind of like revising some of its recommendations just announced today. So masks may be coming back. We totally recommend doing what feels safe for you. Follow CDC, follow your local guidelines, especially if you haven't been vaccinated. So if you have, congrats. If you haven't, you really need to be following the CDC guidelines for mask wearing, quarantining, social distancing, and the like. It is super important that when you are ready,
yes,
which should be hopefully now or soon, you get the COVID vaccine. It is
please get
super
vaccinated
effective at making sure you do not get very sick from COVID. I think about 95 to 99% of hospitalizations are all unvaccinated people. So, get vaccinated. And if you can't for some reason, discuss COVID precautionary measures with those around you. Be mindful of masks, keep your distance, and all of that good stuff.
Absolutely. And to the question that we got, so what is kind of the strategy you would most recommend? Which one has the highest likelihood of success? And will they likely be respective to? So that's a great question. And you're probably like, my answer to that question would be, I think it's all independent on that person or dependent on that person. There's no one strategy that fits all. We can't really tell you that this is going to work better for, X person or Y person. I would definitely just, try the techniques we offer to get them and make them feel more comfortable with seeking help. And then once they go that route, whether it's speaking to a medical provider or, a therapist or whatever that might be, that is helping them on that journey, I would have those conversations, let that person have those conversations with them, because I think that's a very personal approach. I can't give you a more clear and cut answer to that.
Totally agree with that.
What do you think, Brandon?
Yeah, I totally agree. I think it's really personal, and that person, whether it's you or a friend, should really explore all the options available to them. And maybe even try out some of them, see which one is best. It's very personal. Everyone has different needs, and a solution is going to fit differently for everyone.
Absolutely. All right. Well, if you do have any more questions, drop them there in the comments. If not, I do want to tell you all to remember to follow Whitman-Walker on Instagram, Facebook, and Twitter. And continue to check out our website at it's www.whitman-walker.org. And we keep the most up-to-date information about our services and for COVID resources and all of our general Whitman-Walker services. But you can also give us a call at 202-797-4439. But we also have additional programs I want you to follow. Our Whitman-Walker family we're always doing something, right? So you can follow us at Real Talk DC _. You can also follow us at No Filter DC. And then we have a cool art space that we do exhibits and poetry and all type of stuff located on 14th Street at our Liz location. And you can follow us there at The Corner DC. I hope you enjoyed today's topic. And Brandon, want to say goodbye?
Thanks so much, everyone. Great talking to you, Dave. Enjoy the sunshine out there.
All right. Thanks. Talk to you later, Brandon.
Bye.
Bye.